Yeah, thank you very much, moderator, distinguished guests, and all participants of DENGUE360 Innovation in Dengue Prevention. First of all, I would like to thanks to InnoBio and our organizing committee to invite me for sharing my experience. Actually, this is my experience, this is my study. But I hope this study represent the picture of Indonesia on dengue. Uh, the title of my study is Modeling Dengue Intervention in Indonesia. It is a contextual analysis. When we say it is contextual analysis, it is difficult because we use the multi-level analysis. Actually, this is a study for my doctoral programs. I did this study in the year 2012, but I think it is difficult to understand. Okay, this is the background of my study. As we know, WHO estimated about 50 million people infected by dengue virus. And also WHO reported that the number of countries reported of dengue cases is increasing. And also in Indonesia, the number of districts reported of dengue cases also increasing until now. And the problem is where the problem is even we already done many dengue intervention, the problem is the dengue cases is still increasing. This is the picture of dengue cases in Indonesia. This is the cases from 2006 to 2015. As we know that dengue disease is a seasonality, it have a seasonality patterns. So the dengue cases will increase in rainy season, in early rainy seasons, and also in late of rainy season or the early sunny season. So this is the pattern. So there is increasing and decreasing. So the pattern is not changed every year. It is showing the seasonality of dengue cases. And you know, from 2012 until now, the pattern is of the disease in Indonesia is look like increasing. Why this is a very high prevalence in 2006 or 2007? Because we have the big outbreak in Indonesia. Because I think Indonesia, dengue cases have another seasonality. They have 1 year's seasonality or 1 year cycle, and dengue cases also have 5-year cycle. The objective of my study is to develop model for dengue intervention. Here, my study focus only on 3 dengue intervention. One is use of individual insecticide. Second is use of larvicide. And the third is fogging or fumigation. And the specific objective of my study is one, to determine the effect of dengue intervention. So what I mentioned that I only focus on 3 dengue intervention. One is use of individual insecticide. Second is use of larvicide. And the third is of fumigation or fogging. I have to measure this effect in 3 levels. One in household level, 2 in village level, third, in district level. This is what I mentioned about multi-level analysis is difficult. I hope I will make it simple. Then the last of my specific objective is to determine dengue intervention. Here I want to see which one the dengue intervention that I focus on most effective. Okay, this is the conceptual framework of my study. Here, I think the conceptual, the conceptual of the first speaker in the first sessions from Philippines, the dengue fever or dengue hemorrhagic fever, it will be depend on the contact rate between the human and the mosquito. So the increasing of dengue cases is depend the increasing of the contact rate between human and the mosquito. So there is many factors to influence or related to the increasing of contact rate between human and mosquito. Climate factor, socio-demographic factors, household factor, and individual factors. I think it is similar with the conceptual of the first speaker in the first sessions. The difference between the first one with my conceptual framework is I divided all the factors become 3 levels. One is individual level here. The second one is household level. And the third one is community level. So I assume if the factor is just have an effect to contact rate in individual level. These household factors have the effect to the contact rate in household level. So the socio-demographic factor and climate factor, it is have an effect to the contact rate in community level. And also for the dengue intervention have a different effect. The use of individual insecticide have effect in individual level, and the larvicide have an effect in community level, and also the fogging. But the larvicide have to the effect on community level or the household level. So the use of larvicide have an effect to reduce the contact rate in community level and household level. Okay, this is the methodology of my study. My study use of secondary data from National Health Survey. The name of the National Survey, or we call it RISC-DAS 2007. Why I use this National Health Survey data? Because this National Health Survey data is considered is the survey with the biggest sample size compared to other National Health Survey, because we have a regular National Health Survey every 3 years. So after these years, we have a National Health Survey in the year 2010. But consider, I consider because this RISC-DAS or this National Health Survey have the biggest sample size, and also another consideration is this National Health Survey or RISC-DAS measure the disease, dengue disease, by three way of diagnosis. One is based on symptom, two second based on health provider diagnosis, and the third one is based on IgG. While in other National Health Survey, they did not use diagnosis. The diagnosis did not use the IgG. And then in this in my study, I combine the secondary data from the research data with other data from MOH because I have dengue intervention report from MOH, while in this survey we don't have any dengue intervention data in the survey. Only in the survey only have one of dengue intervention variables, which is the use of individual insecticide. So another data that I use in this study is from other study, which Arkari study mentioned about the area of Indonesian. The Arkari divided the area of Indonesia become 4 regions based on humidity, the rainfall, and other seasonality of the area. Then another data I used it for Statistics Center for Indonesia. In this data I used for the population density. In this study, all the sample from the National Health data, from the National Health Survey, this is 2004-7, considered as all my study sample. So this National Health Survey involved 20,902 sample. So all the sample included in my study. This type of my study, I did a systematic review first to determine the effect of dengue intervention study, and I used the National Health Survey and also the data from other study, and also I did the validation to see whether I can use the national health data in the year 2010 or the year 2007. Because if the diagnosis based on symptom or based on health personal diagnosis or based on IgG, it is the same. So I can use the latest one compared to the old one, this one. And I combine all, become the ecological study, and I use multi-level analysis. When we talk about multi-level analysis in modern epidemiology, written by Rothman, I think we can use the individual data in National Health Survey, and the individual data can transfer to aggregate data, and also in other versa, the variable from other study is aggregate data, and also the variable from MOH is aggregate data, and also from Indonesia Statistics Center is aggregate data. I can transfer from the aggregate data to individual data. Okay, and this is the result of the study. From the result of systematic review, the results show that the effect of insecticide, it is proof that already the use of insecticide have an effect to prevent dengue infection. With the effect is OR. OR reflecting the effect can prevent the dengue occurrence 4 times who use insecticide compared to didn't use insecticide. And also from the systematic review proved that the larvicide effective in killing mosquito. the effect of larvicide similar with the effect of fogging. So the fogging proved that in 36 study, the fogging also can killing mosquito. But I mean sorry. I think this one larvicide effective in killing larva of the mosquito. Sorry, and the fogging can killing the mosquito, adult mosquito. And I found 696 the literature for insecticide and 10 literature for larvicide and 36 literature or studies for fogging. And the validation study, unfortunately, the sensitivity and specificity for dengue diagnosis happened by symptom and by health personnel is very, very low. So here in my study, I use diagnosis of dengue cases based on IgG. So why I use RISC-DAS 2007 or National Health Survey 2007 compared to the latest one in the year 2010. And this is the result of the bivariate analysis. So among all my variable here, I have a criteria to select all the variable to proceed to the multi-level analysis. This is the criteria. The criteria is change estimate if the OR more than 10% or p-value of change is less than 0.05 or if there is biological possibility. Meaning if there is a biological viability, this is already established, proven by literature, the effect of some variable. So for the dengue intervention, I force all the variable proceed to multi-level analysis due to biological possibility. The variable who proceed to multi-level analysis were the use of individual insecticide, the use of larvicide, and fogging. This is the dengue intervention variables, and education level, and also the population density. If I back to the conceptual framework, here, this is all the variable that I focus in my study. Okay, when we talk about multi-level analysis, we are going to dealing with OR as the individual effect, dealing with the MOR, median odds ratio, reflecting the variation of the group at the level, because I have 3 levels: hosted level, village level, and district level. And we also dealing with IOR. IOR is the interval odds ratio. Interval odds ratio reflecting if interval is one is in interval, so it is shown shows the effect of variation among cluster higher than effect of contextual variable. Then if the one is not included in the interval odds ratio, it is reflected the effect of variation among cluster less than effect of contextual variables.
5 more minutes, Dr. Miko.
Okay.
Sorry.
This is the effect, the result of the multi-level analysis. It is the use of insecticide in one model, the one variable in the model. So it is the OR is 0.4 9. It is reflecting the effect of insecticide is twice to reduce the dengue occurrence. And also this is the effect of fogging. If it is alone, the effect is just 0.94. It is just likely there is no effect for using a fogging in reducing dengue cases in Indonesia. And this is the effect of use of larvicide is 0.89. It is like very little effect of use of larvicide in reducing of dengue cases in Indonesia. And this is the effect if we combine two dengue intervention, two variables, use of insecticide and foggings. This is the effect, and the use of insecticide and larvicide. This is the effect. So the effect of the use of insecticide is the biggest one compared than other dengue intervention. Even it is in the three variable dengue interventions are combined together. I think the use of insecticide is have the biggest effects. And after that, I compute the contribution. Why I compute the contribution effect here? Because if it is regular logistic regressions, so they only the logistic regression only shows the individual effect. So in multi-level analysis, I compute the contribution factor, and from the contribution factors, it shows that the effect of the use of insecticide and larvicide have biggest contribution. But if it is three variable dengue intervention combined together, is the effect of the contribution is a little bigger, just a little, just increase 9.16 from 9.01 in district level. And after that, I try to make a model from the effect of the contributions with the assumption population growth in Indonesia was arithmetic, dengue prevalence was constant, contribution of dengue intervention was equal for dengue cases and non-cases. The effect of dengue intervention was equal and constant. Effect of dengue intervention was contribution of the intervention in reducing dengue cases. Okay, this is the models. If we implement the use of insecticide alone, larvicide alone, fogging alone, or insecticide, use of insecticide with fogging, use of insecticide with larvicide, or total, all together three variable of dengue intervention, we can see different if we implement it in host level. So this line, it is the line for use of insecticide alone, use of insecticide with larvicide, and all together. So it means if we implemented only use of insecticide or the use of insecticide with larvicide, and altogether use of insecticide, larvicide, and fogging, the reducing of the dengue occurrence in Indonesia is become lower. If there is not implemented, it's become like this. If it is implemented, the gap is very high. And also in failure level, but it's not happen in district level. In district level, there is no difference if we implemented all dengue intervention programs, meaning that the dengue intervention program is not is not working in district level because maybe for dengue occurrence in the area, it is clustering. The conclusion is the use of insecticide, larvicide for fogging, education attainment, and population density play a role in reducing dengue cases in Indonesia. Second one dengue intervention applied in reducing dengue use of insecticide had a biggest effect compared than other dengue intervention. For two dengue intervention variable applied, I think the best effect is if it is combined between between the use of insecticide with the use of larvicide. And the effect of fogging and larvicide have a bigger effect at village and district level compared to its effect in district level. And the last one is the effect of three variables have the highest effect compared than the two combination between the use of insecticide with the use of larvicide and also the use of insecticide alone. Recommendation, so the use of insecticide plus larvicide together should be considered to be implemented in order to reduce the occurrence of dengue, especially in Indonesia. And the use of insecticide and larvicide should be followed by the close monitoring of the using of the larvicide and insecticide, because otherwise we will face with the resistances problem. And I also acknowledge for my dean of faculty, and this one is my advisor during my doctoral program, and also to Directorate Genesis Minister of Health of my country. I think that's all of my presentation. I give back to moderator.
Thank you very much.